the next hour. My name is Sean Trobia. I'm the Associate State Director for Community Outreach for Northern Arizona, and I live in Prescott. And one of the opportunities that we can give to the general public is a session such as this. So I'm going to just not take too much time to say more than I'm going to introduce our presenter today. And I know some of you may know him, but David Parra is my co-worker at the Arizona AARP State Office. Did you have a, yeah, oh, there she's saying hi. Okay, good. Okay, somebody you know, David. David is also an Associate State Director for Community Outreach, and he is in particular does outreach with multicultural groups. And David's also our in-house Medicare 101 guru. That's not an official title, but that's a title that he definitely deserves. And so David is going to be going through the presentation today. A couple of things to note. The presentation is, in fact, it's being recorded right now. It looks like it will be recorded, and it is going to be on AARP Arizona's Facebook page and also on AARP Arizona's YouTube page. So it will be accessible for any of those that want to watch it again or miss the beginning of it or need to step away, but it is being recorded. It will be accessible. Also, David is going to make sure that I have a copy of the PowerPoint that he's going to be going through today. So if any of you, I'll go ahead and work on getting that PowerPoint in a PDF form out to everyone. Okay, after the next, probably some part of the day, a little bit later today. And lastly, I want to give a shout out to our volunteer, Janet Jones. Janet is our Zoom mistress up here in Northern Arizona. So with Janet's assistance, we're able to bring this by Zoom to everybody. So I appreciate Janet. And David, there's Janet. Yay, hi Janet. David, I'm going to go ahead and turn it over to you. Okay, David?
Thank you so very much. It is an honor and a pleasure to join you and to share this information with you. I started working on Medicare since 2011, and we developed a program here at AARP Arizona. We trained some 20 volunteers on several issues, and Medicare by far is one of my favorites. A lot of times I try to prepare for these things, and it seems like the more I try to prepare, the more I confuse myself. So now these days I don't prepare anymore. I just go at it. And we developed this PowerPoint, and it's pretty self-explanatory. I do have some good information to share with you. And as we go, we are going to have an eye on the chat. So I'll pause here and there, and you can send us questions as we go. And then at the very end, we can also open up a minute or two to address any questions you have. I label this the ABCDs of Medicare. As you know, typically we use the thought of, or the concept of the ABCs of something, right? But since Medicare has another part called Part D, I label it the ABCDs of Medicare. We do have the 2020 numbers because some of these numbers that I'll be sharing with you change from year to year. So let's, this is an introduction. The objective is basic information, original Medicare and Medicare Advantage. To be frank with you, if after today's session you are clearer on the difference between original Medicare and Medicare Advantage, we've done our job. Because to me, this is the most fundamental concept in understanding Medicare, and I think your life will be easier if you can differentiate between the two of them. Discussions, who qualifies, the two options, 3 parts, that 7-point comparison. This 7-point comparison is going to be very, very good. So who qualifies for Medicare? Medicare is, you become eligible for Medicare at age 65, but you also have to have 40 credits. And 40 credits, it's points that the Social Security grants you as you pay the contributions to the so-called FICA tax, right? For every quarter that you earn about $1,350, $1,400, you get a quarter a point. So then there's 4 quarters in a year, so you can accrue 4 points, 4 credits, 4 quarters paid a year. In 10 years, they don't have to be consecutive, you would become eligible for Medicare. That's very important. Then let's admit Kate. Sometimes you can get Medicare at an earlier age. If you have been declared disabled by the Social Security Administration, and that benefit is called SSDI, Social Security Disability Insurance, after you've been on that benefit for 2 years, you become eligible for Medicare as well, no matter the age. And also, we have one more point. If this thing would cooperate, let's see. Okay, somehow it's not cooperating. Let me start sharing the video and I'll share it again. For some reason, it got stuck, but I can get it back in just a minute. Hold on just a second. So there is another, like I said, there it is. Another possibility of getting Medicare at an earlier age, anyone with end-stage renal failure at any age, they would be eligible for Medicare. Now, here's 2 options in 3 parts. Please remember, on Medicare, you will have these 2 options. And let me say this right off the bat. When somebody enrolls on Medicare with the Social Security Administration, they will give you Part A and Part B. And I usually say the enrollment with Social Security is incomplete. You must complete the enrollment by either talking to one of the area agencies on aging, an agent if you know one and you trust them, or a broker. But remember, when you get Medicare, the red, white, and blue card with Parts A and B, that's incomplete. Remember that. That's very, very important. So the first choice you're going to have to make after that is, do I want to be on original Medicare or Medicare Advantage, right? So in essence, if you have had insurance through all your life, you get hospital coverage, medical coverage, and drugs, prescription drugs. It's basically the same coverage, but in your job insurance, you don't have the sense of separation, right? You get a packet and that's it. Well, Medicare, somehow they separate the coverage. So you have Part A covers hospital, Part B covers medical, and Part D covers prescription drugs. And you notice that I skipped C. So I didn't say A, B, and D. I've always said that C should not be considered a part of Medicare. Because C is more like an option. In other words, if you get Part C, that refers to Medicare Advantage. You're seeing it on your screen. Medicare Advantage is Part C. When you get Part C, you have a Medicare Advantage plan. You will get all 3, A, B, and D. So sometimes if you read the Medicare in You booklet that Medicare sends to people's homes, you might find the concept of A plus B plus D equals C. This is very important. So this is how Medicare separates the coverage. A, hospital, B, medical, D, drugs, prescription drugs, and then C is that option of Medicare, that second option next to original Medicare. So originally there was only Medicare, and I believe in 1997, if I'm not mistaken, that's when the Medicare Advantage plan started. So that became known as Part C. Very, very important. So let's go through this comparison because this is going to determine which way you go. When you get that Social Security Medicare card and then you complete the enrollment on Medicare, that's when you're going to have to make this choice. You're going to talk to an agent, a broker, or one of the volunteer counselors for the SHIP program with the area agencies on aging. And they're going to basically explain this to you. They're going to say, all right, so we have these 2 options. Do you want original Medicare or do you want Medicare Advantage, which is Part C, right? So what is the difference? 7-point comparison. Fee for service. If you opt for original Medicare, when you go to the doctor, that generates a bill, and they'll be charging Medicare per visit, per service that you acquire. When you opt for Advantage, basically your Part A and B premium, Social Security will give it to the insurance company that you have selected, and now they will take care of you. If you have any issues, you don't come back to Medicare or to CMS. You go to the insurance company because you opted for Medicare Advantage. Medicare Advantage is basically the same as what you had before you reached Medicare age, is what I have right now. It's called managed care. That means they're managing your care. This insurance company is going to manage your care. And they come in the form of HMOs, PPOs, and I think special needs plans. But the most common, I would say, is HMOs. Then if you opt for original Medicare, you have a choice of providers, anyone who accepts Medicare in the whole country, right? You can go to any provider that accepts Medicare, you'll be fine. With Medicare Advantage, no, you have to stay within the network of doctors and hospital, and a specialist referral is required. See the picture? See, so this is the difference between original Medicare and Advantage. Point number 3, the no out-of-pocket limit. Having an out-of-pocket limit is very positive. I know that we don't like the word limit, but in this sense, having an out-of-pocket limit, it's like a cap. That means when you reach a certain amount, you stop paying for the remainder of the year. So that is positive. However, original Medicare does not have an out-of-pocket limit. But guess what? The Medicare Advantage does have an out-of-pocket limit. So when you you opt for a Medicare Advantage, that provider, that insurance company, that plan that you select will tell you, okay, so you have an out-of-pocket limit of $3,000 or $4,000 or $5,000. That means that once you reach that point, you stop paying and the insurance starts covering 100% of the bills. That is extremely positive. You want to have an out-of-pocket limit. So it's important that you know what that limit is. And number one reason for people filing bankruptcy is medical bills. So this out-of-pocket limit comes in to basically protect people from going bankrupt, okay? Now let's go to part number 4. Part B is purchase. When you opt for original Medicare, of course, you went to Social Security, you got Part A, hospital, you got Part B, you need to purchase it. Where if you switch to Advantage, you do not have to pay again for Part B because you already are paying to Social Security. However, let me say this, that at this point, it's important. Some Medicare Advantage plans have additional premiums. Some Medicare Advantage plans have additional premium. I would ask, please mute your lines if you would. Okay, so Part B is included. So let's continue. Number 5, this is very important. If you offer original Medicare, guess what? Part B has a 20% co-insurance. That means that Medicare will only cover 80% of the doctor bills, and you are responsible for the other 20%. If you had an expense of $100,000, you have to pay $20,000. $10,000, you're responsible for $2,000. So that is very important to understand. On Medicare Advantage, there is no co-insurance of 20%. You don't see that. You see co-payments on Part B, which are very, very little compared to that 20%. Okay, so that's very important. Point 6, you must also purchase, if you stay in original Medicare, you must purchase a Part D plan. If you move to a Medicare Advantage, guess what? It comes with it in most cases. So here goes point number 7, right? And I'm getting stuck again here. Okay, there it is. You may combine Medigap or supplemental policy with your original Medicare. Here's where this supplemental insurance Medigap comes in, because the 20% that Medicare doesn't cover, that Medigap policy will step in and cover that. But that'll cost you. This original Medicare option, you're looking at around $300 a month. Whereas if you move to the Advantage side, you cannot combine Medigap with Advantage, because in some sense, you don't need it, because you don't have that 20% co-insurance. So this is basically what you're going to face coming to complete your enrollment on Medicare. And some people, it's a little difficult for them to understand this. I would venture to say that some people feel comfortable. I believe there's like a 40%, 45% of the country is on Medicare Advantage. I think Arizona is a little higher than that, some 47%. So people, the Advantage plans are working hard because they want, obviously, the business, right? They want people to move from original to Advantage. And keep in mind that if you travel, you know, you have two homes in different parts of the country, people tend to go for original Medicare, so they don't have to, they don't have an issue. They can go to providers of choice. People who stay put in one particular area, they tend to go with Medicare Advantage. So let me, I have a note that some plans have additional premium. I'm talking about the Medicare Advantage. So when you see in the news or when the commercials say that, oh, no premiums or zero premium, that means additional premiums because you're still paying the premium forever and ever and ever to Social Security for your Part B. Right now it's at about 148 in 2021. Let me stop sharing for just a second, and I'm going to go to the chat. Is there any questions that I can address at this point? I'll just give a few seconds, and if there are no comments or questions, I can proceed. So I have opened the chat. I'll give just a few seconds. This is very, very important to understand because these two options of original Medicare, also called sometimes traditional Medicare, versus Medicare Advantage. So when people call me and ask me questions, it says, do you have an Advantage plan or are you an original? Almost 100% of the cases, they have no clue what they have, people who call me. So that's why I consider this very, very important. Okay, I will continue to share my screen with you since there are no questions at this time. So here we go. I'm going to select one more time my PowerPoint. There it is. I'm going to run it. And well, actually, let me select the point where I'm at right now. So let's go now to explain original Medicare. Okay, there it is. So let me go into detail a little bit more. So I explained the 7-point comparison. I consider this very, very important. In original Medicare, we're going to talk about hospitalizations, which is Part A. Part B is medical care. Part D is prescription drugs. And we're going to talk about what is not covered, and then the other insurance that you can combine with Medicare. Obviously, Medigap is one of them. So keep in mind that when we are talking about Part A, you have to be admitted to the hospital. Sometimes you go to the hospital, you're in observation. You are not, in other words, you're still under Part B. Part A kicks in when you are admitted to the hospital. It will also cover skilled nursing facility care, which is rehabilitation when you have maybe had a surgery at the hospital. But there's also some requirements there. You must be 3 days in the hospital, hospitalized, admitted before you are eligible for skilled nursing facility care. And you will also have hospice. Hospice is end of life care, and then you have home health care. So that's what Part A covers. Here you don't have a premium. The premium, if you had to pay one, runs about $400+ a month just for Part A. But because we pay the FICA tax for all of our working lives, we don't get charged a premium for Part A. So that's basically what I'm saying there. The deductible. Yes, there is a deductible. And in Part A, under original Medicare, you will face, if you ever, or you know someone who has been hospitalized, or you have, you will face something called the benefit period. The benefit period. So they'll charge you an annual deductible, not an annual deductible. Typically deductibles are annually, but in Part A, original Medicare, you go through an annual, not an annual deductible, but a benefit period. So basically what it says is, I want you to spend 60 days without having to be readmitted. That's the benefit period. So in other words, if you go to the hospital and use 10 days, you are discharged. And then before you spend 60 days without having to be readmitted, you come back, you're still in the benefit period. But the moment you spend consecutive 60 days out of the hospital without the need of being readmitted, you have ended your benefit period. Then the next time you are readmitted, you have to pay the deductible again. That's all I want to say now because of time. Now, co-payments, they at the hospitals, you will have no payments in the hospital for days 1 through 60. Then after you pay the deductible, of course, and then those numbers, you can pause the video if you want to see the actual numbers, but there will be co-payments per day in the hospital, days 1 through 60, no days, I think that should have been, 60 through 90. There's a typo there. It's days, sorry, my microphone is hiding the 6. 61 to 90 is 352 a day and so on. And then you have a reserve day of 6, a lifetime reserve day of 60. So you can tap into that if you run out in any given benefit period of the 90 days. And then the skilled nursing facility care, no payments from days up to 20, and then 20 to 100. You pay 161 days. So those are kind of like the figures. You will get this PowerPoint so you can kind of do it in a more, in a slow way. You can pay attention to those numbers. But in hospital, this is what you will face if you have original Medicare. Keep in mind, original Medicare in hospital Part A. Now let's go to Part B in original Medicare. You will find medical care, doctor, specialists, outpatient care. In other words, you go to have surgery and you're out the same day pretty much. Durable medical equipment and preventive care, preventive services. This is your Part B and under original Medicare. There is a premium. This is the one that is deducted from Social Security. And if you sign up for Medicare before you start receiving your Social Security benefits, they will bill you for 3 months at a time. But there is. And learn this concept. There is something called means tested. People who make, I believe it's $85,000 as an individual or more, or 170 as a couple, they will pay a higher premium for Part B. There is a deductible of $198 a year. And there's no co-payments for Part B in terms of medical care, okay? Then yes, there is co-insurance. So every time you have medical care, you're under original Medicare, you have Part B care, you will be responsible for 20% of the bill unless you have some other policy, Medigap, to cover for that. Part D, prescription drugs, obviously through private insurance companies, you have that. The premium, it varies from plan to plan, and it is means tested as well. If you are a higher earner, you pay higher premiums for Part B. Deductible, typically yes, but there's a lot of variation here. That's why it's important to talk to somebody who knows, who has knowledge of all the plans, because some plans might not have a deductible for Part D. And remember, this is original Medicare. You will learn a little, you will see differences when you go to Medicare Advantage. Co-payments, yes, it varies. Remember, prescription drugs, they put the drugs in tiers, right? So if one plan puts it in this tier, it'll have this price. Then another plan may put the same drug on a different tier. That same drug will cost you less on another plan. So this is where, again, depending on what drugs you take, prescription drugs, you will do good if you review plans and find out which plan works best for you. Co-insurance, yes, there is co-insurance. I know many of you might have heard about the donut hole, which was, I said was, a gap in coverage. There used to be a point where the plan pays up to this amount, I'll pay 75%, you pay 25%. That's what I have here. And then from this amount to this amount, there is a gap. And they used to call that gap the donut hole. There was no coverage. The plan would pay 0. You would have to pay 100% of the cost. And then if you reach a catastrophic stage from this point to that point, then you only pay 5. Well, for a few years since the Obamacare or the Affordable Care Act came along, it started negotiating discounts. So while people were in that gap, donut hole, they were giving them discounts to help folks because the plan covered nothing. Well, up to, I believe, this year, the discount has reached 75%, meaning that people will pay basically the 25% during the gap that they pay during the first stage of coverage. So 25% all through the catastrophic stage. So this is something the Affordable Care Act did, which was very, very positive. And again, I just explained that this is the discounts that that are given during that donut hole. So pretty much we can say that the donut hole has been closed. Remember, original Medicare, Part D. What is not covered? Long-term care is not covered. Most dental care, dentures, eye examinations related to prescription drugs not covered. Cosmetic surgery, acupuncture, believe it or not, is going to be covered in 2021. Good news for many. Hearing aids and exams for fitting them is not covered. Routine food care is not covered. So let's go now. Those that are on original Medicare, they can combine insurance with their coverage. And typically it is Medigap, right? So Medigap, and I'll get into the plans in just a bit, but this is an insurance plan that you buy to cover the gaps that Medicare doesn't cover, okay? So this is called supplemental insurance. It pays for deductible copayments and coinsurance for parts A and B, has a 6-month pre-existing condition sign-up protection. I want to just say a little something here because I think it's important. The Affordable Care Act brought in the concept of pre-existing protection against pre-existing conditions. You have 6 months since you turned 65 and have Part B, 6-month protection against pre-existing conditions, no questions asked. The Medigap, I'm talking about Medigap, will have to sell you a policy. After the 6 months, you are not protected. They will be underwriting, so it's gonna depend on the company. They can charge you more or they can deny you coverage. But during that 6 months, you are protected. May include foreign travel and emergency coverage. This is something you need to find out. Now, Medicare coordinates with other insurance coverages or coverage. It could be from employer, union, VA, TRICARE, federal, long-term care insurance. There is a way if you have another kind of insurance that will coordinate coverage with Medicare, and that you need to basically find out from both, primarily from the source of insurance that you have, say from work, see how it's going to work with Medicare. Medicare functions as primary insurance in some cases and secondary in others. So now here's what I was talking about on original Medicare when people buy Medigap. If you like original Medicare, if you like to go to any doctors of your choice, hospitals, any state of the country, you said, no, I am going to stick with original Medicare and I'm going to buy a Medigap, a supplemental insurance, you're gonna come and face this kind of chart. And this is also on Medicare, on the Medicare and You booklet. You're gonna select from plans A, B, D, G, K, L, M, or N, and basically what you're going to compare is basically how much coverage do I want, right? There's a plan that is going to cover you all the services. You can tell that plan G, if you look at plan G, that seems to be the one that covers the most, but I can guarantee you they'll charge you the most. And then some other plans will cover you the sections on the left, the benefits, and then the percentages. You'll see this kind of chart. So if you want to buy supplemental insurance, you're gonna need to select one of these plans. And so they will not be able to discriminate you for pre-existing conditions during the first 6 months that I mentioned earlier. Very, very important. Okay, so let's go review Medicare Advantage. Medicare Advantage, you know, is very interesting because Medicare Advantage is pretty much the same as what you have now in your employer coverage. So that's why I keep saying these two choices, original versus advantage. Original versus advantage will be I guess the most important decision that you will face when you come into Medicare. And just keep in mind that there are there are times when you can change back and forth from original to advantage, from advantage to original. But keep in mind that if you're going to change from original to advantage, easy. But if you're going to move from advantage to original, remember the pre-existing conditions protection. Remember that this is going to be very, very important. That's why the knowledge will give you a good foundation to make the right choices. So again, we're going to cover the coverage. Remember, so now we have moved to advantage. What are they going to cover? The same thing. Inpatient care, you have to be admitted, in network with HMO, nursing facility care. Let me just mention that hospice is not covered by advantage plans, but original Medicare will step in and cover that service because the insurance companies on their advantage do not cover it, but you will be fine because original will step in and cover hospice. And then home health care. You will not have a premium for hospitalizations. This is what is the equivalent of Part A under original, no deductible. And you see the difference here when you are hospitalized under the advantage option, they basically charge you an amount for a number of days and then they cover the rest. This is how they handle the payment for hospitalizations. A little different than original Medicare. Remember the benefit period concept under original? This is where this is different. Here they'll charge you, they may say, under the plan that you purchase, we're gonna pay we're gonna charge you $250 a day for the first 4 days, and then we'll take care of the rest, basically. And this is per episode. This is not per benefit period, per episode. Once you're out of the hospital, the whole thing starts again. So that's basically a difference you'll see on the two options. No coinsurance. Okay, so medical care, you will get the same care. Medical care, doctor specialists, you have to stay in network with the HMOs, inpatient care, durable medical equipment, and preventive services. Something that is important to note here is that you must be referred to a specialist if you get an advantage plan. That's very important. And original, you do not. The premium. So I put 145, which now is 148 in 2021. So remember, once you start paying the Social Security, that premium for Part B, it doesn't matter whether you stay in original or you move to advantage, you will keep paying that for the rest of your life. The only difference that people on advantage might see is if that plan you purchase has an additional premium. Then you'll see an extra charge there. But some of the plans offer additional services. So if you're paying an additional premium, find out what additional services they are providing. Medicare Advantage plans cannot offer you less than original Medicare, but they can offer you more than original Medicare. So you do have an original a premium under medical care for Advantage. And the means tested is also applies here. It is means tested. Those that make more money pay higher premiums. Okay, so here we go. No deductible on medical care. Remember that the copayment, yes, but it's considerably less than the 20%. Remember, under original, you had a 20% insurance. Actually, it's supposed to be in co-insurance, not a copayment. Where here you do not have the 20%. You do, but you do have copays, which are less. And then obviously no co-insurance. Prescription drugs, again, under original Medicare, under Medicare Advantage, pretty straightforward. You do have the coverage. It comes with the plan, unless you buy a plan that does not include the Part D plan. But if I was you, I would buy one that includes Part D, right? The Advantage plan I'm talking about. So pretty much some do have a deductible, some don't. The premium is means tested again. And then yes, there are co-payments depending on where the drugs are placed on the tiers. And then co-insurance in general, it will be 25%. So you will basically pay about the same 25% for drugs, and the plan will cover 75%. And then if you reach the catastrophic, you'll pay only 5%. So let's talk about, we only have about 20 more minutes. So here's something very interesting. We're going to talk about 3 more points, and then we'll finish. The first one is Medicare Savings Programs and extra help, enrollment periods, and resources. Here's something very important for people who have lower incomes, and I mean lower incomes. There are the programs called Medicare Savings Programs and extra help. So the Medicare Savings Programs, we have 3 of them. Let me show all 3 of them. We call them in terminology that we use is the Quimby, the Slimbys, and the QI1s. Quimby, Slimby, and QA1. These last 2, they pay only for your Part B premium. So people who qualify for these programs are not going to have to pay that $148 a month that is deducted from Social Security. So they'll be able to keep $148 every month because they are of low income, and the Medicare Savings Programs is helping them. Now, the Quimby is the best program. So if you are really, really low income and you qualify for Quimby, you're pretty much getting healthcare for free. So these programs are paid for by, in Arizona, AHCCCS. So AHCCCS, the AHCCCS program comes in to pay for basically whatever Medicare doesn't cover, including the premium, especially on the Quimby one. And on the Quimby one, it gives you the option of getting the benefits that the AHCCCS health plan has. So if you have a Quimby program, if you qualify for Quimby, you're going to be getting more benefits than what Medicare covers. And those benefits are basically what the AHCCCS health plans contain. So you'll add them to your benefits. So qualifying for Quimby is like the best. And then the other 2 will pay you for your Part B premium. And then there's also Medicare Extra Help. This is a low income subsidy. This relates to Part D. So if you qualify for any of the previous programs, you automatically qualify for this one too. So be mindful that there are these two programs that are very helpful, especially when income is very low. It helps with Part D costs. So let me just go back to that. This slide really, especially if you know people who are of low income, or you yourself may be of low income, really understand these 2 programs because they can help you a lot. Now let's go to re-enrollment programs. We have the initial enrollment period, right? When folks are eligible for Medicare originally, they will have 7 months, 3 months before, the month of, and 3 months after the month of their 65th birthday. If you miss that, you will need to wait for the general enrollment period. That means you're going to have to wait until January, from January to March 31st, and then the coverage that you select during that general enrollment period, because you missed the initial, is going to start in July. So you will miss a few months with no coverage if you miss the initial enrollment period. And then penalties for late enrollment may apply. 10% for every year that you delay Part B, and 1% per month that you delay on Part D. So there are penalties involved, and then the fact that you have to start coverage way a few months down the road. So let me just say make another comment here. Some people reach 65 and they're going to continue to work and have health insurance through their work. That is called creditable coverage. You do not have to sign up for Part B if you will continue to work and have coverage. Both have to apply. Work after 65 and have coverage from your job. That's called creditable coverage. You do not have to. Then after you lose either the employment or the insurance coverage, one of the two, because they have to apply that, having employment and insurance through employment, creditable coverage, you will have 8 months to enroll on Medicare Part B. But we don't recommend you to wait that long. We honestly recommend that you do it the week after, if possible, because there are other deadlines related to Part D, which gives you 2 months to enroll, and then the 6-month pre-existing condition protection. You don't want to wait 8 months because that only gives you 6. So what am I saying? Do it ASAP. So the general enrollment period, January 1 to March 31st, if that is missed, right? That will apply if you miss the initial enrollment. This is just what I explained. There could be penalties if you wait too long, and then the penalties are for life. So if somebody is penalized 20% because they spend 2 years without enrolling on Part B, so that's 20% is going to be added to the premium of that year. And to every year new premium, you add 20% to that, 20% to that for the rest of your life. If somebody has the Medicare Savings Programs, those programs pay for those penalties if they apply. Then the special enrollment period is when life events happen, changes in other coverage, you move to another state, to another county, then you can make changes during special enrollment periods, right? So that's basically pretty straightforward. And let me just mention that COBRA is not considered creditable coverage. So if you have COBRA after 65, that's not gonna cut it. You have to enroll on Medicare. Always be in close touch with the HR department to ask these kinds of questions. I'm talking about those that are going to continue to work after 65. That's very, very important. And you know, frankly, I see this often in calls that I get. I think I got like 50 calls in the last month, about 50 calls personally. And many people, you know, tend to work past 65. So all this information is very, very relevant. And then the open enrollment, we are currently on open enrollment. It'll go from October 15 to December 7. Do review your coverage. You can make several changes. Like I said, you can move from original to Advantage, from Advantage to original. You can change your Part D plan. You can change from one Advantage to another, etc. So this is the time to do it. And then there is a Medicare Advantage open enrollment period. This is very, very new. And this only applies to those who are on Advantage. They can basically move back to original or move to another original, Advantage plan. This is fairly new, and it's from January 1 to March 31st. This only applies to those on Advantage. And remember, pre-existing conditions could become an issue. If you're moving from Advantage to original, keep in mind pre-existing conditions. Be proactive if you receive Social Security. Okay, so when people are on Social Security, they automatically are sent at 65 the Medicare card. If you're not ready to enroll, you can return it, and you should. So remember that. Those that are already on Social Security, when they reach 65, they are automatically enrolled. You're not ready to enroll, send it back. If not, they'll start either deducting from your Social Security check the Part B premium or billing you for 3 months, like I mentioned earlier. The websites on government websites are improving a lot. I am very, very pleasantly surprised. You can go to Social Security, ssa.gov benefits/Medicare, and you can enroll on Medicare. You're gonna need to create an account, which is very important, but you can use those pages. Do not procrastinate, avoid decisions. So here's the last point, and I think I'm gonna have at least 10 minutes to entertain some comments or questions. Here's some resources. The SHIP program. The SHIP program is called State Health Insurance Assistance Program. That is a very important tool or resource to have. You have a website there on the screen, and then you can reach the number. The area agencies on aging, in reality, the 800 number is the SHIP program. So no matter where you are in the state, you can call the the area agencies on aging, the number there. I did include region 1 because of the PowerPoint. I didn't, I should have double checked it, but it doesn't hurt. I have this region 1 information, but you will reach your region, wherever you are in the state, by dialing the 800 number. And then you can always go to medicare.gov and you can find information there. And then, of course, AARP, we always keep good information on our website. Guess what? I'm going to stop here and I'm going to entertain some questions. We have 10 more minutes. I have a question. I heard the current administration is trying to change SSDI to requirement enrollment every 6 months. You know, at this point, it hasn't changed, but I did hear some, let's call them comments, rumors, if you will. So let's just wait and see. I know that there's been a lot of comments about several requirements on even Medicaid and so on and so forth under the current administration. So let's see how things will play out, but just keep our eyes and ears open for that and other potential changes. All right, so we have, let's see, we still have 13 people on the call. If there are any other comments or questions, write them on the chat. I think all you have to do is click on the icon that says chat, and it'll open it up, and then you can type in your question. And again, this is being recorded. We will post it on our Facebook page. This is an overview of the program. I mean, I totally encourage you to call one of the Medicare counselors from the area agencies on aging. They are good, extremely good and helpful. They will help you to review your coverage. Also, I mean, if you know of an agent, if you know of a broker, you can do that as well. The area agencies on aging, they are nonprofits. They're nonprofit, and but again, it's a lot of people know agents that they trust. No problem whatsoever. We have no comments so far. Let's see. If anybody has any even if it's not a question, a comment about what you thought about this presentation, is this too overwhelming? It's okay. Just any comments, at least someone write one just to see that the chat is working.
David, there was one question that came in to me privately, but I'll just go ahead and let everybody know the question. One person asked if we're going to get the link for the presentation materials. Can you, I can go ahead and send the PowerPoint in a PDF form to all of the people that registered. So all of you can expect that email from me with the PowerPoint itself in a PDF form. And then when it comes to the recording, I understand that it'll be posted on the AARP Arizona Facebook page and the AARP Arizona YouTube. Is that right, David?
That is correct. And I just chatted on that, and I says watch presentation on Facebook at AARP Arizona, and YouTube, same name. So give me, by this afternoon, I believe I can upload both on both platforms, and you can watch this, or you can share it with friends, recommend it if you think it's worth it.
Okay, and Deanna, Deanna has a question in there too, David, if you can see that on the chat.
Yes. Basically, pre-existing conditions, I'm telling you, this is a big deal. I mean, even as they are considering the ACA, this has been like the main issues. Even when the ACA was became law, that was one of the big nuggets of that law, that people would not be denied coverage because of pre-existing conditions. So sometimes people say, how about when I come to Medicare, am I protected? Does that protection, excuse me, apply? The answer is yes, but only for 6 months. So that's when you turn 65 and have Part B. That starts ticking. The clock starts ticking when you turn 65 or older, and then you have Part B, then you have 6 months, and they will have nothing to say. And this only applies to the Medigap policies. no Medicare Advantage plan, of course, nor the original will deny you coverage. We are talking about the Medigap. Only Medigap will make it an issue if you try to buy a plan after the 6-month protection. Yes. So I think that addressed the question about pre-existing conditions. Any other before we finish? Thank you, Jody, for the comment. Any comments, Rich? I know that when you were on the list as a registrar, I said, "Oh, Rich is going to be there. He's very knowledgeable, so I better do good." So, what do you think before we end the meeting?
It moved very fast, but it was very accurate and very helpful. I would like to use the presentation when I have audiences up here in Prescott area, because I think it lays it out. You need really more choice, but that would require significant more time to start talking about why and what are some of the trade-offs you make, not just technically, but because of your personal health issues in selecting Advantage and Medicare, from my opinion.
So you're saying
but that's a very
that first
personal
choice
kind of thing.
You're talking about the first choice people will make, whether to stay on original or move to Advantage, right? That trade-off.
My sense is a lot of people don't know what they don't know about how the billing systems work in the various plans, and they make a decision for Advantage based on low cost alone.
Right.
I think they need to understand that an Advantage plan, they have to be very careful about what the panel selects for the physicians they can see, what hospitals, and if they're comfortable with that, great. But if they aren't comfortable with it, or they don't know where they are, or they aren't sure that the doctor they want within the panel is accepting new patients, then they better proceed carefully.
Right. Thank you, Rich. Anybody else before we end? Okay.
David, there is one more question there from Deanna.
Oh, yeah. So if you purchase the Medigap when you are newly on Medicare or Medicare Advantage, if you are continuously insured, this would not be an issue going forward as long as you keep Medigap, or is Medigap just, okay. Technically, no, but remember, you're no longer protected under that 6-month period. So let me say that technically they most likely say, all right, so this person has had insurance, they'll probably be underwriting, if you will. But my point is that you are no longer under the 6 months pre-existing protection. You're no longer under by law, but I believe if you have been insured, the underwriting and that kind of stuff may go in a different direction. But you know, I just want to say that by law you have moved beyond that period. Okay, that's all I can say. But obviously, you want to check with the plan that you want to purchase, the Medigap plan, and basically ask them, is it an issue? Will I have an issue with the pre-existing conditions? That's what I think it would be wise to do before you make the move. Okay. Yeah. Well, Sean and everyone, it's been a pleasure for me to have the opportunity to share this information. I hope it was helpful. I will make the PowerPoint in PDF format available for Sean to distribute to the group. And then I believe, let me see, did I include my, no, let me include my name and my email address. If you ever have a question and you feel I can help, by all means, give me a call. There you go. D Part AARP 480-414-7637. So thank you so much. So now this concludes the presentation, and if we can stop the recording, have yourselves a great day.
Thank you, David, so much.